March 15th, 1943. Heidelberg Military Hospital, Germany. Sister Maria Hoffmann adjusted her starched white cap and prepared for another grueling day, treating wounded soldiers from the Eastern Front. The corridors echoed with groans of pain, desperate calls for water, and the hurried footsteps of medical staff overwhelmed by casualties streaming in from Stalingrad's aftermath. As head nurse of Ward 7, Maria had seen everything. Shattered bones, infected wounds, men barely clinging to life. Nothing surprised her anymore, or so she thought. The ambulances arrived at dawn, carrying prisoners of war requiring immediate medical attention. Standard procedure dictated that enemy wounded received basic treatment only after German soldiers were stabilized. Maria glanced through the intake reports. Soviet soldiers mostly. A few British airmen shot down over Munich. Then her eyes stopped on an unusual entry. American Negro soldier, multiple shrapnel wounds, conscious but critical. She'd never treated a black patient before. In fact, she'd never seen a black person in her life. Nazi medical training had been explicit about racial hierarchies in treatment protocols. Aryan patients received priority, followed by other Europeans, with non-Europeans receiving minimal care only when resources permitted. The textbooks described different physiological responses to pain among racial groups, claiming some races were more primitive in their reactions to medical procedures. Maria had accepted these teachings without question. Why wouldn't she? They came from professors, medical authorities, people she trusted implicitly. But when the stretcher bearers carried the wounded soldier into Ward 7, Maria experienced something she couldn't have anticipated. The man was young, perhaps 22, with intelligent eyes that tracked movement despite his obvious pain. Blood seeped through hastily applied field dressings on his chest and left arm. His breathing was laboured but controlled. Most striking was his composure. No screaming, no panic, just the steady gaze of someone assessing his situation with remarkable clarity. Maria approached the stretcher, clipboard in hand, expecting to work through an interpreter. The hospital employed several prisoners of war who spoke basic German for communication purposes. Standard medical German was simple enough. Point to areas of pain, nod for yes, shake head for no. She'd managed dozens of foreign patients this way, without complications. But before she could signal for a translator, the wounded soldier spoke directly to her in German, so perfect it stopped her in her tracks. Guten Morgen, Schwester. Ich verstehe, dass meine Verletzungen schwer sind, aber ich bin bei Bewusstsein und kann alle Fragen über meine medizinische Geschichte beantworten. Good morning, sister. I understand my injuries are severe, but I am conscious and can answer any questions about my medical history. Maria stared, her clipboard forgotten. The accent was flawless, educated, with subtle inflections that suggested formal study rather than casual conversation. This wasn't broken German learned in prisoner camps or elementary phrases memorized for survival. This was the German of universities, of medical texts, of intellectual discourse. The contradiction made no sense in her carefully ordered worldview. Dr. Heinrich Weber, the attending physician, arrived for morning rounds and noticed Maria's frozen posture. Weber was a veteran of both wars, a pragmatist who prided himself on medical efficiency regardless of politics. He treated enemy wounded before and expected standard procedures. Point, examine, treat, move on. When he saw the black American patient, his first instinct was to call for an interpreter. Then the patient addressed him directly. Herr Doktor, wenn ich darf, meine Verletzungen sind hauptsächlich oberflächlich, aber ich glaube, ein Granatsplitter könnte nahe dem Herzen sitzen. Ich habe medizinische Ausbildung und verstehe die Symptome. Doctor, if I may, my injuries are mostly superficial, but I believe shrapnel may be lodged near my heart. I have medical training and understand the symptoms. Weber's eyebrows shot up. Medical training? This Negro soldier was discussing his condition using technical terminology that many German medical students would struggle to master. He described symptoms with precision, explained sensation patterns, even suggested diagnostic procedures. Weber found himself engaged in a professional consultation with a patient he'd been taught to view as barely human. The wounded soldier, Staff Sergeant William Thompson from Detroit, had graduated from Howard University Medical School before being drafted into the segregated army. His path to a German hospital bed was complex. Assigned to a medical unit supporting combat operations in North Africa, Thompson had been captured during the retreat from Kasserine Pass. His medical knowledge made him valuable to German field hospitals desperate for trained personnel, regardless of his race. But his education and language skills weren't mentioned in prisoner records. German administrators saw only another Negro prisoner, categorized and dismissed according to racial ideology. Sister Anna Kaufmann, Maria's assistant, whispered urgently, "How does he speak like that? They told us these people couldn't learn properly, that their minds weren't developed enough for complex language." Anna had been trained at the Reich School of Nursing, where racial science was mandatory curriculum. Every textbook, every lecture, every examination had reinforced the same message. Different races possessed different intellectual capacities. Education couldn't overcome biological limitations. Yet here was undeniable evidence that everything she'd learned was wrong. Thompson, despite his pain, recognized the nurse's confusion. He'd encountered similar reactions before. His fluency in German, acquired during graduate study at Heidelberg University before the war, consistently surprised people who'd never questioned their assumptions about race and intelligence. But he also understood his precarious position. German medical facilities weren't bound by Geneva Convention protections for prisoners of war. His survival depended on proving his value while navigating the dangerous waters of Nazi racial ideology. "Ich studierte vor dem Krieg an der Universität Heidelberg", Thompson explained carefully. "Mein Hauptfach war Medizin mit Schwerpunkt Chirurgie. I studied at Heidelberg University before the war. My major was medicine with a focus on surgery." The statement hung in the air like a challenge to everything the medical staff believed about racial capabilities. Thompson had walked these same hospital corridors as a student, learned from some of the same professors who'd later developed Nazi medical doctrine, studied in libraries where racial science textbooks were written. Dr. Weber struggled with cognitive dissonance so profound it threatened his entire professional worldview. If this Negro soldier had studied at Heidelberg, if he understood medical procedures, if he could discuss surgical techniques with sophistication that impressed a German physician, then what did that say about the racial theories Weber had accepted without question? Either this man was an impossible exception, or the theories themselves were fundamentally flawed. The examination that followed challenged every assumption the medical staff held. Thompson described his symptoms with clinical precision, suggested treatment protocols, even warned about potential complications based on his own medical knowledge. When Weber hesitated over a particular procedure, Thompson offered professional advice that proved accurate. The patient was teaching the doctor, and everyone in the room understood the implications. Other nurses gathered to witness this unprecedented situation. Word spread through the hospital corridors about the Negro prisoner who spoke perfect German and understood medicine better than some residents. Some staff members refused to believe it, insisting there must be some deception involved. Others watched quietly, processing information that contradicted everything they'd been taught about racial hierarchies. Sister Maria found herself questioning fundamental assumptions for the first time in her life. If this educated, articulate, professionally competent man was supposedly inferior according to Nazi ideology, then what else might that ideology have gotten wrong? The question was dangerous, potentially treasonous, but impossible to ignore when confronted with such overwhelming evidence. Thompson's mere presence had become a teaching moment more powerful than any university lecture, challenging beliefs that seemed unshakable just hours before. But before we explore how this encounter unfolded and the profound impact it had on everyone involved, subscribe to the channel and let me know in the comments where you're watching from. These untold stories of World War II reveal truths that challenge everything we thought we knew about human nature, prejudice, and the power of individual dignity to overcome systematic oppression. Thompson's medical knowledge wasn't just impressive, it was essential. The hospital faced critical shortages of qualified personnel as the war intensified. Experienced surgeons were deployed to field hospitals closer to combat zones, leaving behind overworked residents and exhausted nurses struggling with complex cases. When Thompson accurately diagnosed a post-operative infection that Weber had missed, the dynamic shifted completely. Bei Wunde zeigt Anzeichen von Sepsis, Thompson observed during Webers rounds. Die Temperatur des Patienten kombiniert mit der Verfärbung die Naht deutet auf eine bakterielle Infektion hin. The wound shows signs of sepsis. The patient's temperature, combined with discoloration around the suture, indicates bacterial infection. Weber checked Thompson's assessment and found it correct. A German soldier's life was saved because a black American prisoner possessed superior diagnostic skills. The implications terrified hospital administrators. Oberarzt Klaus Richter, the chief medical officer, faced an impossible contradiction. Military regulations prohibited relying on prisoners for medical decisions, especially Negro prisoners classified as subhuman by Nazi doctrine. Yet his hospital needed Thompson's expertise to maintain patient care standards. The practical necessity of saving German lives conflicted directly with ideological purity. Thompson understood his leverage, but used it carefully. He offered medical assistance without appearing to challenge German authority. When consulted about difficult cases, he phrased suggestions as humble observations rather than professional recommendations. Perhaps the Herr Doctor might consider, he would begin, then provide analysis that consistently proved accurate. His diplomatic approach allowed German physicians to accept his help, without acknowledging they were taking orders from someone Nazi ideology deemed inferior. Sister Maria watched these interactions with growing amazement. Thompson's bedside manner impressed patients who initially recoiled from his appearance. He spoke to wounded German soldiers with compassion, explained procedures in terms they understood, provided comfort during painful treatments. His gentleness contradicted every stereotype she'd absorbed about Negro violence and primitiveness. Patients began requesting the educated prisoner for consultations, praising his knowledge and kindness. The transformation wasn't immediate or universal. Some staff members, particularly those with deep Nazi commitments, refused to acknowledge Thompson's capabilities. They attributed his medical knowledge to memorization rather than understanding, claimed his German fluency must be fraudulent, insisted his diagnostic successes were lucky guesses. Nurse Greta Zimmermann, a devoted party member, complained to administrators about relying on subhuman prisoners for medical decisions. But practical results spoke louder than ideological objections. Thompson's interventions reduced infection rates, improved surgical outcomes, and identified complications before they became life-threatening. When a young Wehrmacht officer developed mysterious symptoms that baffled German doctors, Thompson correctly diagnosed appendicitis complicated by internal bleeding. Emergency surgery saved the officer's life, and his grateful family sent letters praising the medical staff's expertise. Dr. Weber found himself in an impossible position. His professional integrity demanded acknowledging Thompson's superior diagnostic abilities, but his political survival required maintaining Nazi racial orthodoxy. He developed a careful dance of language, describing Thompson as an unusually trained prisoner with limited medical exposure, rather than admitting he was consulting with a colleague whose education exceeded his own. The hospital's other prisoners watched Thompson's treatment with mixed emotions. Some resented the preferential treatment his medical skills earned him. Others recognized that his success created opportunities for all prisoners to be viewed as potentially valuable rather than merely expendable. Soviet prisoners began claiming technical expertise they didn't possess, hoping to replicate Thompson's protected status. Thompson's reputation spread beyond Ward 7. German medical officers from other facilities requested consultations on difficult cases. A Luftwaffe pilot suffering from mysterious neurological symptoms was brought to Heidelberg specifically because the Negro prisoner had demonstrated expertise in brain injuries. Thompson's diagnosis of traumatic brain injury, with delayed presentation, proved correct, leading to treatment that restored the pilot's cognitive function. These successes created a protective bubble around Thompson, but also increased scrutiny from SS investigators suspicious of any prisoner receiving unusual privileges. Oberfuhrer Heinrich Müller arrived unannounced to investigate reports of a Negro prisoner providing medical advice to German personnel. His interrogation revealed the depth of Thompson's education and the extent of his influence on hospital operations. Müller faced the same cognitive dissonance that had challenged everyone who encountered Thompson. Here was undeniable proof that Nazi racial theories were wrong, demonstrated by a man whose existence contradicted fundamental assumptions about human hierarchy. But acknowledging this truth would undermine the entire ideological structure that justified the SS's existence. The solution was bureaucratic genius. Müller classified Thompson as a special category prisoner with limited technical utility, whose medical background made him valuable for specific tasks while emphasizing that individual exceptions didn't challenge racial science. This classification allowed the hospital to continue using Thompson's expertise while maintaining ideological consistency for administrative purposes. Sister Maria's worldview continued cracking under the weight of daily contradictions. She watched Thompson teach German medical students diagnostic techniques, saw him comfort dying patients with more compassion than many German staff members showed, observed his professional collaboration with physicians who grudgingly admitted his superior knowledge. Each interaction demolished another piece of the racist foundation her education had built. Her personal crisis deepened when Thompson saved her brother's life. Corporal Franz Hoffmann arrived at the hospital with severe burns from a tank explosion, his injuries so extensive that German doctors initially considered his case hopeless. Thompson examined Franz carefully and proposed an experimental treatment protocol he'd studied at Howard University. The procedure required precise timing and careful monitoring, but offered the only chance for survival. Maria found herself begging Thompson to help her brother, then questioning why she was pleading with someone Nazi ideology classified as subhuman. The contradiction was stark and undeniable. If Thompson was inferior, why was he the only person capable of saving Franz? If he was capable of such medical expertise, how could any racial hierarchy make sense? The treatment succeeded. Franz recovered with minimal scarring, his life saved by knowledge Thompson had acquired at a Negro medical school that Nazi doctrine claimed couldn't provide real education. Maria sat beside her brother's bed, watching Thompson check his progress, and felt her entire belief system collapsing. Other staff members experienced similar transformations. Dr. Weber began questioning colleagues privately about the scientific basis for racial medicine. Sister Anna started reading medical journals Thompson had mentioned, discovering research by Negro physicians that had been dismissed without examination. Even some SS personnel, witnessing Thompson's competence firsthand, began wondering whether their training had been accurate. These quiet revelations spread through whispered conversations and carefully worded observations. Nobody openly challenged Nazi ideology, but many began harboring private doubts about racial science. Thompson's presence had become a catalyst for intellectual honesty that threatened the hospital's ideological conformity. The situation grew more complex when Thompson diagnosed Dr. Weber with early-stage heart disease, identifying symptoms Weber had ignored or misattributed to stress. The treatment Thompson recommended proved effective, but the irony was overwhelming. A Negro prisoner was providing life-saving medical care to the German physician who'd initially viewed him as barely human. Weber couldn't reconcile this reality with his ideological training. Thompson's influence extended beyond individual medical cases. The hospital's infection control protocols, developed through his quiet suggestions, reduced mortality rates by 15% over 6 months. German Military Medical Command noticed these improvements, but attributed them to better supply management, rather than acknowledging assistance from a Negro prisoner. Official reports praised Dr. Weber's innovative approaches without mentioning their true source. The deception required constant vigilance. When medical inspectors arrived for routine evaluations, Thompson retreated to menial tasks while German staff presented his ideas as their own discoveries. Sister Maria watched these charades with growing discomfort, witnessing the intellectual theft that allowed German physicians to maintain their reputations while benefiting from Thompson's expertise. Young medical students posed particular challenges. Dr. Weber's teaching rounds now incorporated techniques Thompson had shared, but Weber struggled to explain methodologies he hadn't fully mastered himself. When students asked probing questions about diagnostic reasoning, Weber found himself parroting explanations Thompson had provided without understanding the underlying principles. Student Friedrich Kellner noticed these inconsistencies during a complex surgery. Weber's technique seemed uncertain, his explanations incomplete. Later, Kellner observed Weber consulting privately with the Negro decisions. The student prisoner, before making critical, began connecting patterns that revealed the true source of Weber's recent medical innovations. Kellner's discovery created a dangerous situation. As a dedicated Nazi Party member, studying medicine through SS sponsorship, he should have reported Weber's collaboration with a subhuman prisoner immediately. But Kellner also witnessed Thompson's surgical precision during emergency procedures, saw him correctly diagnose conditions that stumped experienced physicians, observed his gentle treatment of German patients who praised his care. The cognitive dissonance paralyzed Kellner's decision-making. Nazi ideology demanded he expose this racial contamination of German medicine. Professional honesty forced him to acknowledge Thompson's superior abilities. Personal gratitude complicated matters further when Thompson identified Kellner's own appendicitis before symptoms became acute, preventing a potentially fatal emergency. Thompson navigated these relationships with extraordinary diplomatic skill. He recognized each person's psychological boundaries and adjusted his approach accordingly. With true believers like Nurse Zimmermann, he remained invisible, avoiding interactions that might trigger ideological reflexes. With conflicted individuals like Dr. Weber, he provided medical expertise while allowing Germans to claim credit publicly. His most delicate relationship was with Oberfuhrer Müller, who returned periodically to monitor the situation. Thompson understood that one misstep could result in transfer to a concentration camp or immediate execution. During Müller's visits, Thompson performed manual labor while German staff carefully avoided mentioning his medical contributions. These inspections created elaborate deceptions involving the entire ward. Medical charts were altered to remove evidence of Thompson's diagnoses. Treatment protocols he'd developed were attributed to German physicians. Patients who'd praised his care were coached to credit German medical staff instead. The conspiracy required coordination from dozens of people who'd learned to value practical results over ideological purity. Sister Maria became Thompson's most reliable protector, warning him about surprise inspections and helping maintain the fiction of his lowly status. Her transformation from devoted Nazi follower to secret collaborator represented a personal revolution that terrified and liberated her simultaneously. She'd discovered that everything she'd believed about racial hierarchy was demonstrably false, but acknowledging this truth meant accepting that her entire worldview was built on lies. The psychological impact spread beyond the medical staff to patients themselves. German soldiers who'd been treated by Thompson faced their own cognitive dissonance. They'd been saved by someone Nazi ideology classified as subhuman, cared for with compassion by a man they'd been taught to despise. Some resolved this contradiction through denial, convincing themselves that Thompson's medical knowledge was somehow fraudulent despite evidence of his competence. Others experienced profound shifts in perspective. Corporal Hans Richter, recovering from severe pneumonia that Thompson had correctly diagnosed when German doctors missed it, wrote letters home questioning the racial education he'd received. His parents, loyal party members, were disturbed by their son's new attitudes about Negro intelligence and capability. These individual transformations created ripple effects that extended far beyond the hospital walls. German soldiers returned to their units, carrying stories about the educated Negro prisoner who spoke perfect German and understood medicine better than German doctors. Military censors couldn't suppress these accounts entirely, and rumours spread through Wehrmacht ranks about exceptional prisoners who contradicted racial stereotypes. Thompson's reputation reached German military medical headquarters through unofficial channels. Several high-ranking officers expressed interest in consulting with this unusually qualified prisoner, but political considerations made official recognition impossible. The German military needed Thompson's expertise while maintaining the fiction that such expertise couldn't exist in a Negro. The contradictions multiplied as Thompson's influence grew. German medical journals published papers based on his research without attribution. Treatment protocols he'd developed were incorporated into Wehrmacht medical training without acknowledging their source. His innovations saved German lives, while official doctrine insisted he was incapable of meaningful medical contribution. Dr. Weber's career flourished as he presented Thompson's work as his own discoveries. Medical conferences praised Weber's innovative approaches to battlefield medicine, unaware that his breakthroughs originated from a Negro prisoner deemed subhuman by Nazi science. Weber accepted these accolades while privately wrestling with the ethical implications of his deception. The hospital's other German physicians gradually became aware of Thompson's role through careful observation and whispered conversations. Dr. Schmidt noticed that Weber's diagnostic accuracy improved dramatically whenever the Negro prisoner was present during examinations. Dr. Hoffman observed that complex surgical procedures succeeded more often when Thompson assisted, even in unofficial capacities. This growing awareness created a conspiracy of silence that protected Thompson while challenging everyone's fundamental beliefs about race and capability. German physicians found themselves dependent on medical expertise from someone their ideology insisted was intellectually inferior. The contradiction was impossible to resolve without abandoning core Nazi principles. Thompson understood his precarious position and used his influence carefully to help other prisoners when possible. He diagnosed illnesses among Soviet POWs, provided medical advice that improved conditions in prisoner barracks, and quietly sabotaged attempts to use prisoners for dangerous medical experiments. His protected status allowed him to advocate for basic medical care that saved hundreds of lives. His efforts weren't always successful. When SS physicians arrived to conduct medical experiments on prisoners, Thompson's protests were ignored despite his demonstrated expertise. He watched helplessly as prisoners were subjected to procedures that violated every principle of medical ethics he'd sworn to uphold. These experiences reinforced his understanding that individual relationships couldn't overcome systemic evil. The hospital's German staff faced similar limitations. Despite recognizing Thompson's humanity and competence, they remained complicit in a system that classified him as subhuman. Their personal relationships with Thompson couldn't protect other Negro prisoners from systematic persecution. The cognitive dissonance created by these contradictions left lasting psychological scars on many German medical personnel. As the war's momentum shifted against Germany, Thompson's situation became increasingly complex. Retreating German forces brought more wounded soldiers requiring advanced medical care that only Thompson could provide. Simultaneously, Nazi authorities grew more suspicious of any deviation from racial orthodoxy as military defeats undermined confidence in German superiority. The balance between practical necessity and ideological purity became harder to maintain. Thompson's medical expertise was desperately needed, but his very competence challenged fundamental assumptions about racial hierarchy that Nazi leadership couldn't afford to question. The contradiction would ultimately force everyone involved to choose between survival and ideology, between truth and the comfortable lies they'd believed their entire lives. The breaking point came in October 1943, when a convoy of wounded Waffen-SS officers arrived at Heidelberg after a disastrous engagement near Kiev. Among them was Oberfuhrer Karl Brenner, a fanatical party ideologist who'd built his career on racial purity doctrine and medical theories about Aryan superiority. Brenner suffered from severe internal injuries that baffled the German medical staff. Multiple consultations yielded conflicting diagnoses, while Brenner's condition deteriorated rapidly. Dr. Weber recognized the symptoms from previous cases Thompson had handled, but protocol demanded treating the highest-ranking Nazi officer without consultation with any prisoner, especially a Negro. Weber attempted the standard treatments, while Brenner's fever spiked and his blood pressure dropped dangerously. Sister Maria watched the Oberfuhrer dying from complications that Thompson could diagnose within minutes, but mentioning the prisoner's expertise would be tantamount to treason. Thompson observed the crisis from across the ward, understanding exactly what was happening. Brenner showed classic signs of internal bleeding complicated by infection, requiring immediate surgical intervention using techniques Thompson had pioneered at Howard University. But speaking up meant exposing himself to execution, while remaining silent meant watching ants. The moral a man die from complexity was staggering. Brenner represented everything Thompson despised about Nazi ideology. This was the man who'd written medical papers justifying sterilization of inferior races, who'd supervised experiments on prisoners, who'd argued that Negro soldiers should receive no medical treatment whatsoever. Yet Thompson's medical oath demanded he try to save every life, regardless of personal feelings. Dr. Weber's desperation finally overcame his political caution. During a brief moment when SS guards stepped outside, Weber approached Thompson's bed and whispered urgently, "What do you see when you look at the Oberfuhrer?" Thompson understood the coded request immediately. Speaking in medical German so technical that any listening guards wouldn't comprehend, he provided a rapid diagnosis that identified the exact location of internal bleeding and the surgical approach required to save Brenner's life. Weber performed the emergency surgery using Thompson's guidance, transmitted through subtle hand signals and barely audible whispers. The procedure succeeded brilliantly, stopping the hemorrhage and clearing the infection. That would have killed Brenner within hours. The Oberfuhrer's recovery was so dramatic that SS medical inspectors demanded detailed reports on the innovative surgical techniques employed. Brenner himself, recovering consciousness, praised Dr. Weber as a medical genius whose Aryan intellect had developed breakthrough surgical methods. Weber accepted the accolades while Thompson remained invisible, credited with nothing despite saving the life of a man who considered him subhuman. The irony was so profound that several German nurses began openly questioning the logic of racial hierarchies. Sister Anna whispered to Maria during night duty, "If that Negro prisoner understands medicine better than our best doctors, and if his knowledge saved the Oberfuhrer's life, then what does that make our racial science? Are we the ones who've been living lies?" The questions hung in the air, like forbidden thoughts that couldn't be unthought once spoken. Thompson's intervention created unexpected complications. Brenner's recovery was so complete, and his gratitude to Dr. Weber so effusive, that he arranged for Weber to present his surgical innovations at the Reich Medical Congress in Berlin. Weber faced the terrifying prospect of explaining techniques he didn't fully understand to Germany's most distinguished physicians, knowing that any technical questions would expose his dependence on a Negro prisoner's expertise. The deception required elaborate preparation. Thompson spent hours coaching Weber on surgical principles, explaining the theoretical foundations behind each technique, anticipating questions that medical experts might ask. Weber memorized responses like an actor learning lines, understanding the words without grasping the deeper knowledge they represented. Meanwhile, hospital records were systematically altered to remove any trace of Thompson's involvement in medical decisions. Patient charts that mentioned the educated prisoner's diagnoses were rewritten. Treatment protocols he'd developed were backdated, and attributed to German physicians. The conspiracy now involved dozens of staff members who'd learned to value results over racial ideology. Young medical students became the most dangerous observers. Friedrich Kellner, whose appendicitis Thompson had diagnosed, began studying the Negro prisoner with scientific curiosity that transcended political indoctrination. Kellner noticed patterns in Weber's consultations, observed Thompson's subtle contributions during medical procedures, and gradually pieced together the truth about the hospital's most closely guarded secret. The revelation shattered Kellner's worldview more completely than anyone else's. As a product of Nazi educational systems, he'd absorbed racial theories as scientific fact from childhood. His entire academic career was built on assumptions about Aryan intellectual superiority that Thompson's existence demolished. The cognitive dissonance created a psychological crisis that left Kellner questioning everything he'd been taught. Kellner's response was unexpected. Instead of reporting the racial contamination to SS authorities, he began secretly studying with Thompson, learning diagnostic techniques and surgical principles that weren't taught in German medical schools. The prisoner became the teacher, while the German student absorbed knowledge from someone Nazi doctrine insisted was incapable of higher learning. These clandestine lessons occurred during night shifts when SS supervision was minimal. Thompson shared medical insights developed at Howard University, explained research by Negro physicians that German academia had dismissed without examination, and demonstrated diagnostic methods that consistently proved more accurate than conventional German approaches. Kellner discovered that Negro medical schools had developed innovations years ahead of German institutions. The student-teacher relationship violated every principle of Nazi racial hierarchy, yet it produced medical breakthroughs that saved German lives. Kellner's diagnostic accuracy improved dramatically under Thompson's tutelage, leading to correct identification of conditions that experienced German physicians missed. The practical benefits were undeniable, even as the ideological implications remained unthinkable. Other staff members gradually became aware of these midnight tutorials. Sister Maria discovered Kellner and Thompson discussing surgical anatomy in whispered German, the student taking notes while the prisoner explained complex procedures with professorial authority. The scene inverted every assumption about intelligence and racial capability that Maria had accepted since childhood. Dr. Weber's Berlin presentation approached with mounting anxiety. He'd practiced Thompson's techniques until he could perform them competently, but his understanding remained superficial. When Germany's leading surgeons questioned theoretical foundations or requested modifications to procedures, Weber would be exposed as a fraud dependent on a Negro prisoner's knowledge. Thompson understood Weber's dilemma and proposed a solution that demonstrated extraordinary generosity towards someone who'd initially viewed him as subhuman. He suggested that Weber present the techniques as collaborative research with American colleagues, implying international cooperation that predated the war. This approach would allow Weber to acknowledge limitations in his theoretical knowledge while maintaining credibility with German medical authorities. The strategy worked perfectly. Weber's presentation received enthusiastic reception from German physicians impressed by innovative surgical approaches. When questioners probed deeper than Weber's knowledge allowed, he referenced ongoing research with American universities that the war had interrupted. The audience accepted these explanations while praising German medical ingenuity for developing such advanced techniques. Weber returned from Berlin with enhanced reputation and official recognition as one of Germany's most innovative surgeons. Medical journals requested articles describing his breakthrough methods. Universities invited him to lecture on advanced surgical principles. His career flourished based entirely on knowledge borrowed from a prisoner he'd been taught to consider intellectually inferior. The success created new moral complications. Weber's fame grew, while Thompson remained invisible, receiving no credit for innovations that were revolutionizing German military medicine. The prisoner who'd developed these life-saving techniques was denied even basic recognition, while the German, who'd memorized them, received national acclaim. Thompson watched Weber's elevation with complex emotions. Professional pride in seeing his work validated mixed with bitter resentment at the systematic theft of his intellectual contributions. He'd saved hundreds of German lives through medical innovations that were improving Wehrmacht battlefield medicine, yet remained classified as subhuman by the very system that benefited from his expertise. Thompson survived the war and returned to Detroit, where he practiced medicine in segregated hospitals until civil rights legislation finally opened doors that should never have been closed. Dr. Weber spent decades wrestling with the knowledge that his career was built on stolen brilliance from a man Nazi ideology deemed subhuman. Sister Maria became a quiet advocate for racial equality, carrying the lesson that individual human dignity transcends every artificial hierarchy society constructs. Their story reminds us that truth has a way of surfacing, even in the darkest places, challenging us to examine our own assumptions about human worth and capability.